I was at home and one day the owner of a pharmacy in my village called and she said, Marian, there's a Venezuelan guy here. He works at a Chinese restaurant. He comes across, he buys a soft drink because he knows to sell drinks at the pharmacy. And he's trying to explain to me, apparently he needs help. He wants to leave where he's working and I can't understand him. I know you speak Spanish, so can you come up and help? And I said, okay, I'll come up. So I went that day and I realized he was having problems where he was working, he wanted to leave. He had not registered with the UNHCR and he wanted to go to Living Waters. He didn't know how to go. And there started my journey. We need a doctor, they need a doctor. Unfortunately, medical care is not so forthcoming for them in Trinidad and Tobago. And I've seen that personally. On one occasion, there was a lady came to me, she was bleeding, not very heavily, but she was bleeding and she couldn't understand what was going on because she had done some procedures in Venezuela and she was saying, well, I shouldn't be bleeding. So I said, well, we will go to the hospital, but I'm not too sure based on previous experiences if they will attend to you. So I prayed about it, so we went to the AMMR Health Center. We got to triage, the nurse checked, she had her UNHCR card, she didn't have the other one. So we passed there, said, okay, good, God answer our prayer. So we're going down to the clinic now so that the doctor could attend to her. So it was her turn and we went in. The nurse called her to check her blood pressure, the sugar, before you see the doctor, you do these things. And the nurse looked at me and she said, what you doing here? You know she shouldn't be here. Why did you bring her here? No, they are drain on our health care. No, she's not to be here at all. She cannot come back. You have to pay for her private test, but the lady is bleeding. She said she has to go privately. But God, she allowed her to go. I mean, the press did work. She allowed her to see the Cuban doctor who spoke Spanish and he spoke to her, but we couldn't because she made it very clear that we couldn't go back. So that I helped her with some money to go and get other checks and and basically that's it. Then there's the health fair. You see so many people. I was present at one in February in AMMR. So many, they are so grateful. So grateful for the vaccines and the testing of just the simple blood pressure and all the different tests offered there. The shots, the influenza shots, the yellow fever shots, and they are so grateful.